Discuss about acid reflux in babies. Babies often spit up and there could be some stomach acid in it. Though not enough to cause problem in normal for babies. To spit up bit even if there is some stomach acid in it. It usually does not bother them much but babies can have GERD which making feed hard and causes a problem. Babies born too early or with issues in their esophagus are more likely to have GERD. If your baby seems to having a tough time, the doctor might check for the condition. Signs of GERD in babies and small kind include being very fussy, trouble sleeping, non-wanted to eat, throwing up a little bit, wheezing and hoarse sound, bad breath. Acid reflux. It's time to see your doctor if you have any acid reflux symptom. Two or more times or wait for if medication do not bring lasting relief. Symptoms such as heartburn are the key of diagnosis of acid reflux disease, especially if the lifestyle changes. NSAIDs and acid blocking medication help reduce those symptoms. If these steps do not help or you have frequent or severe symptoms, your doctor may order tests to confirm a diagnosis or check for other problems. You may need one or more tests such as these. Barium swallow radiograph. Your doctor may use this special X-ray procedure to rule out any structural problems in your esophagus. In this painless acid reflux test, they ask you to swallow a solution of barium. The barium lets doctor take X-ray for your esophagus, but barium swallow is not certified method of diagnosis GERD. Only one in every three people with GERD have esophageal changes visible on X-ray. Endoscopy (REGR). During an endoscope, the doctor inserts a small tube with a camera on the end through the mouth into the esophagus. This lets the doctor see the lining of esophagus of stomach. Before inserting the tube, your esophagus may give you mild sedative to help you relax. The doctor may also spray your throat with analgesics to make a procedure more comfortable. This acid reflux test typically lasts about 20 minutes. It's not only painful or will not interfere with your ability to breathe. Will this test may detect some complication of breath, including esophagus and Barrett's. Esophagus only about half of the people with acid reflux disease have visible changes of lining the esophagus. Biopsy. Depending on the what EGD shows, your doctor may decide to perform a biopsy during the procedure. On this in case, your gastrolith will pass a tiny surgical instrument. Through the scope, you remove a small piece of lining in esophagus. This send a tissue sample a pathology lab for of analysis. There is will assess to see if there is a disease, such as esophageal cancer. Esophageal monitoring your doctor may perform this test to help diagnose acid reflux. It shows how well your esophagus is working and checks to see if the esophageal sphincter, a value between the stomach and esophagus, is working as well as it should. After applying a number of agents inside of your nose, the doctor will ask you to remain seated. Then they will pass a narrow flexible tube through your nose and esophagus in your stomach. When the tube is in correct position, the doctor will you have lie on your left side. When you do, sensor on the tube will measure the pressure at the various places inside your esophagus and stomach. To further see how well your esophagus is working, you may need to take a few sips of water. The series on the tube will record the muscle contraction in your esophagus as the water passes in your stomach. Esophageal impedance monitoring. The test gets even more detailed picture how well your esophagus is working. Can be done along the monitoring is used to monitor tube with electrodes placed at various points along its length. It's mere the rate at which liquid and gases passes through your esophagus. When your doctor compares these results with your monitoring finding, they can judge how your esophageal contraction moves substance through your esophagus into your stomach. So they are the medication monitoring.